Hello.
Hi.
Would you mind if I did a head-to-toe assessment today?
No.
It's okay to do it?
Yes.
It's okay.
He said, do you mind?
Yeah, okay. All right, so we're going to first start by checking your hands. If you want to just put out your hands for me. Now, I know you just had you just had a recent surgery on your thumb tendonitis.
Yes.
All right, so we'll be careful not to put too much pressure on that hand. All right. You want to turn your hands this way. Okay. All right, turn them back the other way. Okay. So your hands feel warm. Um, they're not sweaty or clammy or anything like that. I'm going to check your capillary refill, and that looks like less than 2 seconds. Check on this side. Yep, less than 2 seconds. I'm going to check your skin tuger, and that looks like good rebound. All right, yep, very good. Now I'm going to check your scalp. If you don't mind, if you want to just put your head down a little bit, and what I'm looking for is any lesions or lumps, and also I'm checking see if any scaling, dryness, and it looks like your hair is well distributed, and I don't see any lumps or anything like that. Very good. So can you close your eyes for me? Okay, yeah, very good. So that tells me that cranial nerves 2 are, that's what your face. Can you smile for me as well? Okay, so those are your what they call cranial nerves 7, and that looks like they're operating well. um, so I'm going to check your temporal arteries. Yeah. All right. Very good. And now I'm gonna just lower my hands, and I'm gonna check your what they call the mandibular joints. And now, can you open your mouth for me? Okay, close your mouth. All right, open it back up again and go side to side with your jaw. All right, very good. Okay. Now I'm going to look at your ears. Just pull your hair back a little bit for me. Yeah. And what I'm looking for is symmetry, and your ears look even. And I'm going to look for any lesions. Your skin color looks pink. Okay, and now what I'm going to do is I'm going to pull back on the meatus, and I'm going to put a little bit of pressure to call your tragus, and just let me know if there's any pain there.
No.
Okay. The other side as well. Any pain?
No.
Okay, good. All right. Now your nose looks like it's midline in your face. If you take your finger and kind of put pressure on one side of your nose, can you breathe? Okay, try the other side. Yep, very good. Okay, so now I'm gonna take my pen light, and I'm gonna have you open your mouth, and I'm gonna look at your gums. You look all nice and pink. Your buccal mucosa looks pink as well. No lesions, no bleeding on your gums. Now I'm going to ask you to stick out your tongue and say ah. Okay. So your uvula and your soft palate have both rise midline as they should, and pretty good. So I noticed you don't have your tonsils. You've had those removed.
Yes.
Okay. Good. All right. So now I'm going to look at your neck, and your trachea looks midline, supple. And now I'm going to, there's no lesions. I'm going to palpate your carotid pulse, one at a time. Because if you palpate both at the same time, you can actually stop the blood flow to your brain. And I'm also checking for what they call thrills. That's similar to like a cat when the cat purrs. So I don't, I'm able to test a pulse, feel for a pulse, but no thrills, which is good. I'm going to auscultate your carotid, and what I'm doing is I'm actually checking to see if I can't hear any brutes, which is what they call a murmur, which would be like a swish, and would be like a slight blockage. Pretty good. Now, can you, are you able to move your neck side to side? All right. Can you touch your chest with your chin? All right. How about backwards? Okay, very good. So now I'm going to palpate for your lymph nodes, cervical lymph nodes. I'm going to first check for your trapezius muscle, which is posterior, and then just interior to your trapezius muscle lymph nodes. So I'm going to palpate from the top, work my way down. Okay, and now what I'm going to do is I'm going to palpate for your sternomastoid muscle, which is in the front here, and you do have some nodes that are superficial on that muscle, and then just posterior to the mastoid muscle you have some deep nodes, so I'm going to put a little bit of pressure. Okay, so what I'm doing is basically palpating to see if you have any nodules. If you do, obviously that would be a concern. But generally, on an older adult, we're not able to palpate the nodes. So now what I'm going to do is I'm going to look at your trachea. It's midline, so I'm going to assess to see if there's any deviation. And to do that, I'm going to put a bit of pressure to one side and see if your trach actually moves over, pushes over, and it doesn't. And I'm going to do the same thing on the other side. And it stays midline. Okay, so now I'm going to go behind you, and I'm going to palpate for your thyroid gland, and I'm going to first see where the thyroid cartilage is, and then just beneath that would be your thyroid gland. And what I'm going to have you do is I'm going to push to the left, and I'm going to palpate to the right. So I need you to turn your head to the right, to your shoulder. No, I'm sorry. Bend your head towards your shoulders. There you are. Yep. Okay. Now I'm going to have you do this the opposite to the left. Okay. All right. All right, now I'm going to check your eyes. What I'm checking is the extraocular muscles. So what I'm going to have you do is I'm going to put my finger in front of you, and I'm going to want you to follow my finger. All right. Now what this is called is the sixth cardinal position of gaze, and what that is actually doing is you have muscles that control the movement of your eyes. So I'm just checking to see if those muscles are good and you did fine. So next, I'm going to check your Okay. All right, so now I'm going to check what they call the corneal light reflex. So I'm going to use my pen light, and I'm basically going to do is I'm going to shine the light at the bridge of your nose. So all you need to do is just look at the light. And I'm basically, what I can see is two lights that are going into your pupils. And what I'm checking for is any deviation of one of your eyeballs. So in other words, it would be a lateral or superior movement of your eyeball, either down or, but it would be not fixed, it would be going the other way. And both your eyes are looking towards me, and I can see both lights in your pupils, which we're supposed to see. So that's negative, which is good. It's a good thing. Okay, so next, I'm going to check, see if you're reactive on your pupils. Now you just look towards me. Very good. So both pupils are round, reactive to light, equally reactive to light. So next, what I'm going to do is I'm going to check to see how your eyes adjust. And I forget the name of this test, but how your eyes, your pupils will adjust to looking at a far distant object to when I bring my finger in. So basically what I'm going to have you do is gaze at an object far away, and then I'm going to do is I'm going to bring my finger in and then look at my finger. Very good. So what's happened is your pupils have actually constricted and both your eyes converged, almost looking like cross-eyed, and that's what your eyes are supposed to do. All right, so now what we'll do is I'm going to assess your posterior thorax. So I'm going to go behind you here. And what I'm looking at is I'm looking at your shoulders. Your shoulders are even bilaterally. And then what I'm going to do is I'm looking at the skin on your posterior thorax. And your skin looks fine. I don't see any swelling. I don't see any lesions. Looks pink. So now what I'm going to do is I'm going to check your spinal column. And I'm going to make sure that your spinal column is in alignment. I'm going to feel down. I don't feel any lumps. Looks all in alignment. And
back door open.
Okay. So now I'm going to do what they call a tactile frementis. And what I'm going to do is I'm going to use the ball of my fingers, and as I palpate across the interior of your thorax, I need you to say 99. So we'll start from the top here. Okay?
99. 99. 99. 99. 99. 99. 99. 99.
Very good. Okay. So basically, what I'm checking with this assessment is to see that I'm getting the same vibrations bilaterally on both sides. And if I felt a different vibration on one side, then that would suggest probably like a pneumothorax, emphysema, some sort of restriction in the lungs. So I didn't feel that, so it feels pretty good. So I'm going to auscultate now to hear your lung sounds. All right, I'm gonna need you to take a deep breath. Again. Okay, and I'm gonna check your interior. Okay, so I have not heard any inventatious sounds. So now what I'm going to do is I'm going to assess your what they call the costrovertebral angle, which is just about your 12th rib. And what I'm assessing is for any kidney pain. So I'm going to put my hand on about the 12th rib, and I'm going to kind of give it a pop with my hand. You tell me if you feel any pain?
No.
Do the same to the side.
No.
No pain. Okay, good. Alright, so now I'm going to check the interior portion of your chest. I'm going to listen to your sounds, lung sounds. Take a deep breath. Again, I'm going to go inside. Okay. Now what I'm going to do is I'm going to check the for your cardiac, what they call the apex, which is just about your 5th intercostal space. And what I'm going to do is I'm going to be actually listening to your heart. Now, I need you to just lean forward for me a bit. Okay. That what that does, it allows the rib cage to go forward, so it gives me a better auscultation to the heart. Okay, so what I'm listening for is for any murmurs, and again, it would be like a swish, and I haven't heard anything as such. So what I need you to do now, if you can lie down. Okay, so what I'm going to look at right now, I'm going to see if there's any pulsations. I'm going to look at the your skin. The skin looks fine, looks pink. I see a few scars here, and I think you've had your gallbladder.
Yes.
Correct? Okay. But I'm also looking at what they call heaves, which would be a raising of the skin, and I don't see any of that. And so it looks pretty good. So I'm going to auscultate your heart, and what I'm going to do, I'm going to start on the right side, which is the I'm actually going to be listening to your aortic, and that's on the right side, 2nd intercostal space. All right. Now I'm going to check your pulmonary, and that's on the left 2nd intercostal space. And then the tricuspid. I think the screen is still, I think it's still, yeah, I think it's still taping. It's just, all right, so we checked at the pulmonic, and that is fine. I have not heard any murmurs. So now I'm going to go to the tricuspid. And now the mitral. Okay. Now I'm going to repeat it again, but this time I'm going to use the bell, and that will actually help me listen to if there's any murmurs. Okay. So what I'm going to have you do is just turn your head for me to the left. And what I'm looking for is any jugular vein distension or pulses. And if you want to turn back this way, and I don't see any distension of visual pulses. Okay. So now I'm going to listen to your bowel sounds. So I'm going to start with your right lower quadrant. And right upper quadrant. And then to the left upper quadrant. And then the lower left quadrant. Okay, and you have, I do hear vowel sounds, and they're hypoactive. So I'm going to auscultate for your renal artery, which is just a little bit. And then the iliac artery. Okay. So I didn't hear any murmurs in either sections of your arteries. So now what I'm going to do is I'm going to percuss in the four quadrants, starting on this right lower quadrant. And what I'm doing is I'm percussing to see if there's any masses. If there's a difference in tone as I'm percussing, that would indicate that you may have a mass in that area. So what I'm going to do is I'm sorry if I'm tickling you. Okay. So I'm basically doing a zigzag motion in each quadrant. that seems to be okay. Um, Now what I'm going to do is I'm going to palpate, but I'm going to first lightly palpate. So I'm going to need to move your shirt back up again. Sorry. So I'm going to lightly palpate the area, and again I'm checking for masses or tenderness. Okay. Now what I'm going to do is I'm going to deep palpate to see to palpate for your liver, which is just beneath your rib cage, which is right about here. Right about here. So this is where I'm palpating. And then your spleen, which is on the left-hand side, you're doing the same thing. Okay. All right. So while I have you lying down, I'm going to check your lower extremities. So what I'd like you to do is take your legs and move them apart. Okay. So what we call that is abduction, and then you can move your legs back in. That's adduction. Okay. So I'm going to do some resistance over here. So try to go ahead and open your legs. Okay. Yep. Now go ahead and open your legs, and I'm going to do resistance this way. All right. Very good. All right. Now, next I'm going to push on your foot, and that's what we call dorsiflex. If you want to push down. All right. Very good. Same thing here. Push down. Okay. Yep. Good. And then I'm going to push down on the interior of your foot if you want to pull up. Very good. And the same thing here. Pull up. All right. I'm going to check your between your toes. I'm going to check the capillary refill of your large great toe. And that's below 2 seconds. Very good. All right, so, and I'm also looking at your skin, looking for lesions. Also what I'm going to do is I'm going to palpate for any edematous, and I don't see any edema in the lower extremities. Okay, so now what I want to have you do is bend your knee up, both knees. Okay, and so now I'm going to have you move one of your legs down. Very good. And I'm doing this, I'm checking your hips. And then you can move your knee back up. And the same thing with this knee. Very good. Okay. All right, so I guess I'm going to have you sit back up. So I'm going to check your pulses. First, you know what, and I do need to check your radial pulse. You have good radial pulse. Good. Now I'm going to check you. If you want to move your hands, just put them on right down the side here. I'm going to check your popliteal pulses. Okay. On the side. All right, now I'm going to check your tibia, the interior of your tibia pulse, which is Now I'm going to check the pedal pulses, which is right along the top of your foot, in line with your great toe. Which I'm actually able to palpate that. Okay, so now what I'd like you to do is grab one of my two fingers. I want to test your hand strength. Very good. Yep. The other one. All right. Yep. I know that's the hand you had surgery in. Now I want you to be able to take your. I want to check for ulnar deviation. So just take your. Very good. And also now, if you want to make a fist for me, both hands, okay, and just spread out your fingers, and don't let me bring your fingers together. No, keep your fingers. Don't let me bring your fingers. There you go. Yep. Okay. And now I want to test your arm strength. So if you want to just make a muscle for me, and yep, don't let me. Yep, I'm going to give you resistance. Now push back. Very good. Same thing with this arm. Don't let me pull back. Pull it towards you. Okay. Now push. Okay. Good. Now I want you to be able to take your arms like that. Yep. Bring them back in. All right. Like that. All right. And that's abduction and abduction of your arms. Good. All right. Okay, I think one other thing is just your shoulders. I'm going to put pressure on your shoulders. Now, can you shrug up your shoulders? Good. All right. Very good. So now I'm going to test your. Now I forget the name of this test, but however, it's your sensation to be able to tell me what I put in your hands. Okay, so if you want to open up your right hand, close your eyes. Tell me what you think that is.
Quarter.
Yep. Okay. Good. Now I'm going to also test for your sensation of touch. So I'm going to first start with your face. So if you want to just close your eyes. And when I touch you, you tell me yes.
Yes. Yes. Yes. Yes. Yes. Yes.
All right, then we'll do the same thing with your arms.
Yes. Yes.
And the legs.
Yes. 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 Yes.
Okay. Now what I'm going to do is I'm going to alternate. I've got a sharp point and soft. So you're going to tell me if it's sharp or soft. Okay?
Both sides?
Yep.
Soft. Soft. Hard. Hard. Soft. Hard. 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 Hard.
Okay. Now, if you give me your hand, what I'm going to do is, this is they call it a position test. I'm going to have you close your eyes, and when I move your finger, either up or down, you're going to tell me which direction I'm moving in.
Down. Down. Up. Up. Down.
Okay. Very good. Now we're going to check your reflexes. So I'm going to pull this chair. Your deep muscle reflexes. Just let your legs dangle. Okay, it's not much, but you see your leg moving.
Yeah.
All right. So now what I'd like you to do, if you want to stand up for me. Oh, let me pull this up a bit so you can. Yeah, go ahead. Yeah, if you want to stand on the floor, yeah. I'm going to have you walk. All right. If you want to just walk a little ways in that direction. Okay, now come back towards me. Now, when you walk back towards me, I want you to go from heel to toe. Yep. All right, good. Now, can you walk on your toes? All right, now how about your heels? Very good. All right, so if you come back this way, what I'm going to do is what they call the, I believe it's called the Romberg sign. And what I'm going to have you do is close your eyes. And I'm basically assessing your equilibrium to see how much, if you sway or not. And actually, that's pretty good. No swaying at all. Okay, you can open your eyes. Okay. Then I think this is going to be the last thing. I'm going to check your hips. So what I'd like you to do, if you kind of face this way, kind of turn, twist at the hips. Okay, good. Now can you bend over and touch your toes? Watch your head. Good. All right. And I think this concludes the test, the assessment. I'm sorry. Thank you very much.
Thank you.